Schizophrenia is a psychotic disorder which is characterized by delusions, hallucinations, disorganized thinking, abnormal motor behavior, and negative symptoms. Delusions are fixed beliefs. They can be deemed bizarre if implausible, or non-bizarre if plausible. There are several types of delusions. First up, we have the persecutory delusion, which is the belief that one is going to be harmed or harassed by an individual, an organization, or a group. This is the most common type of delusion. Second, we have the referential delusion, which is the belief that certain gestures or comments are directed at oneself. These are also quite common. Thirdly, the grandiose delusion is when an individual believes that he or she has exceptional abilities, wealth, or even fame. Next is the erotomantic delusion. An example of this is when an individual falsely believes that another person is in love with him or her. Next, we have the nihilistic delusion, which involves the conviction that a major catastrophe will occur. Finally, we have the somatic delusion, which focuses on preoccupations regarding health and organ function. Hallucinations are perception-like experiences that occur without an external stimulus. They are as clear and vivid as normal perceptions. The most common hallucination is an auditory hallucination, which is most commonly experienced as voices. Disorganized thinking, also known as formal thought disorder, is usually identified through speech. For example, when an individual is speaking, they may switch randomly from topic to topic. There are many different types of abnormal or grossly disorganized behavior, ranging from stillness to unpredictable agitation. Another example is catatonia, which is characterized by a decrease in reactivity to the environment. This could range from resisting instructions to complete loss of verbal and motor responses. Negative symptoms of schizophrenia include diminished emotional expression, avolition, alogia, anhedonia, and asociality. Diminished emotional expression is characterized by reduced eye contact, facial emotion, speech intonation, and normal movements during speech. Avolition is a decrease in self-initiated activities. For instance, an individual may show little interest in working or other social activities. Alogia is diminished speech output, very similar to aphasia. During conversation, the individual may respond with very brief answers, or none at all. Anhedonia is the inability to experience pleasure from positive stimuli. Asociality is a lack of interest in social interactions, or a preference for solitary activities. It can be associated with avolition. 2 of the 5 symptoms shown must be present during a 1-month period. The individual's level of functioning in work, self-care, or interpersonal relations must have decayed. Signs of disturbance must persist for at least 6 months. Schizoaffective disorder, depressive disorder, and bipolar disorder must have been ruled out. The disturbance must not be attributed to a medication's effects. For our connection, we used antagonists. For example, the antagonist and antipsychotic drug haloperidol can block the receptor sites for dopamine, which helps to regulate delusions and hallucinations.